Hello everyone. By the request of my awesome summer 2015 A&P course, or my A&P students, I am going to record a lecture or a video for the muscular system. Because this is a big unit, I'm going to split it into the muscles of the head and the neck, the torso muscles, then followed by the arm muscles and the leg muscles. So let's get started over here. I'm going to select the blue pen. Now, with the muscular system, one of the things that we need to be aware of is the origins, insertions, and the actions of muscle. So when I talk about what the origin of the muscle is, it tells you where the muscle originates. The insertion tells you where the muscle ends up. And the action would be what the muscle performs, the kind of task or the kind of job that the muscle performs. So for example, we have adductors, we have abductors, we have flexors, we have extensors. So that all of those would be the actions of the muscle. Now the following couple of tables give you a few pointers about how muscles are classified based on their orientation, their relative size versus their relative shape. So anytime a muscle has the name rectus in it, it means that it is parallel to the midline. So think of your mid-sagittal plane or your parasagittal planes. So anytime it is parallel to the midline, it would be a rectus muscle. So rectus muscles are also perpendicular to the ground in standard anatomical positions. A transverse muscle is something that is perpendicular to the midline. So right along the transverse plane of the body. And an oblique muscle is something that's neither parallel to the ground nor parallel to the midline. So an example of a rectus muscle is rectus abdominis, which are your six-pack muscles right here in the abdominal region on the ventral side. Transverse muscle examples. One is transverse abdominis. Another example of this is the diaphragm, which is also a transverse muscle. And we have obliques as well on our lateral abdominal or lateral lumbar region. The relative size of the muscle gives you an idea about the size of that particular muscle in relation to the muscles that are generally around it. So one of the examples that I'm going to go over is major versus minor, because there are a lot of pairs where one muscle is the major, one muscle is the minor. In the face, an example of a pair of major and minor is the zygomaticus muscle. So we have a zygomaticus major and a zygomaticus minor that are oriented along the zygomatic arch. In the back, we have the rhomboid major and the rhomboid minor, and the teres major and the teres minor. So usually these are muscles that are adjacent to each other. One is the bigger of the two, one is the smaller of the two. And the shape of the muscle gives you quite a bit of clue as to where the muscle is located, what the job of the muscle would be as well. So deltoid would be a delta is a triangle. So the deltoid muscle is a muscle that superficially covers our acromial region. We have in the posterior side of the neck, the superficial muscle is the trapezius, so it's in the shape of a trapezoid. Anything that has kind of jagged edges would be a serratus muscle. So we're going to go over all of these types of muscles as we go through the muscles unit. Classification based on the action as well. So this tells you what the muscle does. So knowing these two tables is extremely helpful in order to retain information from the muscles unit in general. So what we're going to start with in this video is muscles of the face. So let's get started. This slide goes over what the action is, what the origin is, and what insertion is. So an example for this is the biceps brachii muscle. So look at the term biceps and brachii. Bicep means that this particular muscle has 2 points of origin. Brachii is for the brachial region. So this muscle right here, and I'm going to point out to where this muscle is located, that right there is the biceps brachii muscle. And it originates from the glenoid cavity located on the scapula and the coracoid process also located on the scapula. So that is where this muscle originates, and you can see the tendon right here. So it originates from the glenoid cavity and the coracoid process, travels down towards the elbow and inserts itself into the radial tuberosity right over here. Whoops. So the radial tuberosity is that little bump or the tuberosity that is located on the radius bone. Now it starts on the scapula, ends in the radius, and its action is flexion of the elbow. Anytime you see the term flexion, it means decreasing the angle of a joint. So think about yourself standing in standard anatomical position and then decrease the angle of the elbow. So when you decrease the angle of the elbow, that is called flexion of the elbow, and the biceps brachii muscle is helping you do that. Alright, so here's where we begin with the facial muscles. Now let's start right on top of the cranium, right here. You see this white stuff. This white stuff is called the epicranial aponeurosis. So it's kind of a tendon. We don't have a muscle right on the top of our cranium. So that is referred to as the epicranial aponeurosis. The muscle that is over the forehead, so this guy right here, that is part of a 2-muscle group. And it's named after the bones it covers. So the bone in this region is the frontal bone. So this muscle covers the frontal bone, and it also covers the occipital bone at the back and the base of our skull. So in the next slide we're going to look at the lateral view, but this muscle is called the occipitofrontalis muscle for occipital bone and the frontal bone. Now this part where the X is, that is referred to either as the frontal belly of occipitofrontalis or simply frontalis. Now, the occipital and frontal bellies, so you have an occipital belly of occipitofrontalis and the frontal belly of the occipitofrontalis. And the connective tissue right here, the white stuff, which is tendon, is called the epicranial aponeurosis. The action of this muscle is to help you raise your eyebrows. So it's the muscle that helps draw your eyebrows superior and anterior. And it inserts itself into the epicranial aponeurosis as well as the skin next to the supraorbital margin. So your right or the top margin of the eye socket. Now the next muscle that we're going to go over is an orbicularis muscle. So anytime you see the term orbicularis, think orb-like, so circular muscles. We have 2 circular muscles on our face, one surrounding the eye, this guy right here, that is called the orbicularis oculi. Orbicularis is circular or orb-like, oculi refers to the eyes. So this muscle helps you close your eyelid. So that is the orbicularis oculi. Now the next muscle down, this guy right here, is helping you lift up or elevate your upper lip. So look at the name of this muscle. Levator labii superioris. Levator is anything that elevates or levitates. Labii refers to lips. And superioris for the superior lip, which is the upper lip. So the levator labii superioris helps you elevate your upper lip. And the next muscle that we're going to go over is the zygomaticus pair. So the zygomaticus pair is located right over here. You can see two muscles, one on top and one on the bottom. And if you look closely, the muscle on the top is slightly smaller than the muscle on the bottom. And that is your zygomaticus pair. The one on top is called the zygomaticus minor, and the one on the bottom is the zygomaticus major. And their origin is that zygomatic bone. It's kind of, these muscles are oriented along the zygomatic arch. Now the next muscle we're going to go over is oriented kind of along the same way as the zygomaticus pair is, but it's inferior to them both. So this guy right here. So that muscle helps us make a grimacing face. So when you're mad, when you're not amused, you use your rhizorius muscle to grimace. Now, anything that is a platysma muscle stands for a flat, slender, thin muscle. And we have this muscle, which is the most superficial muscle in this region, is right over here. If you pout your face, you can actually feel the platysma going down your neck. So that is a muscle that kind of helps you pout or make the sad face. So you have rhizorius that helps you make the grimacing face, and you have the platysma that helps you make the pouting or the sad face. The next muscle we're going to go over is the muscle that helps you depress or lower your lower lip. So if the muscle that elevates the upper lip is called levator labii superioris, the muscle that depresses your lower lip would be called the depressor labii inferioris. Depressor for the action, labii for lip, and inferioris for the lower lip. So this muscle is helping you depress your lower lip. So we've gone over the rhizorius, we've gone over the platysma, the levator labii superioris, the depressor labii inferioris, the zygomaticus pair, and the orbicularis oculi. Now the second circular or orb-like muscle on the face is the orbicularis oris. So oris refers to the area around the lips. So this circular muscle right here is the orbicularis oris, and it helps you close your lips and therefore close your mouth. The muscle of the chin region is called the mental region, and the chin muscle is called the mentalis muscle. It protrudes, so when you make that pout face or the sad face, the platysma is helping you make the pout face. The mentalis is helping you protrude your lower lip. So it's like the face that someone makes, the puppy dog face. That is when the mentalis and the platysma are helping you make that little pout. Now the next muscle we're going to go over is a muscle with a very cool sounding name. It's called the buccinator. Buccinator helps you move or kind of control your buccal cavity. So think of it as a muscle that controls your buccal cavity. And it's this guy right over here. So I'm kind of trying to, no, that's the masseter. Okay, I'm trying to get it with my fingers here. That right there is the buccinator. So the buccinator is a deeper muscle. If you look at the right side of this specimen, it is a superficial view. His left side is the deep view. So the buccinator is a deeper muscle, and it helps you make the whistling face. So it helps you make an O with your lips. So when you drink out of the straw, that's what the buccinator is helping you do. So here's the lateral view of all the muscles that we have gone over. So let's do a quick recap of the stuff we've already gone over so far. So here's the epicranial aponeurosis. Here is the frontal belly of the occipitofrontalis, the occipital belly of the occipitofrontalis. Then you have the orbicularis oculi, followed by the zygomaticus minor, the zygomaticus major, the rhizorius, the buccinator. I don't know why it keeps doing that. So that's the buccinator right there. This one is the orbicularis oris. Then you have the depressor labii inferioris and the levator labii superioris right here. This one right here is the platysma. Now the next muscle that we're going to go over is the temporalis muscle. This guy right here. And it's a relatively superficial muscle. This is the right lateral superficial view, and it covers the temporal bone. So what I would like you to do, so if you want to remember all of this, just try to do vocab drills. So go over all of the muscles of the face, repeat, until you're bored, and then repeat some more. The next set of muscles are referred to as the extrinsic eye muscles, or the eye muscles that control the movement of the entire eyeball itself. And there's quite a few muscles that control the movement of the eyeball. Now think about this. You are able to elevate your eyeball. So when you look, when you don't move your head, but you just look upwards with your eyeballs itself, that is elevating the eyeball. When you do, without moving your head, when you look downwards, that is depressing the eyeball. The same way you can also abduct the eyeball, look away towards your peripheral side, that is abduction of the eyeball, or you could look towards your nose, which is adduction of the eyeball. In addition to these movements, you can also rotate your eyeballs. So think rolling your eyes. So you can also rotate your eyeballs. And you have 4 sets of rectus muscles. Again, a rectus muscle is one that runs parallel to the midline. And you have 2 sets of oblique muscles. Now the muscle to the lateral side of the eyeball is the lateral rectus. The lateral rectus abducts your eyeball. So when you move your eyeball away from your median, that is the courtesy of the lateral rectus. So towards your nose, or towards the medial side, you have a medial rectus, which helps you do the opposite. It adducts the eyeball. On the bottom, you have the inferior rectus, which helps you depress the eyeball or look downwards. On the top, you have the superior rectus, which helps you elevate the eyeball or look up. Now the oblique muscles, the top one is not too clear in here, but you can kind of see it right there. That is a superior oblique, and this one is the inferior oblique. So the superior oblique helps you depress, so look downwards. It abducts, so it helps you look away from the median, and laterally rotates your eyeball, so rotation away from the midline. The inferior oblique will elevate, abduct, as well as laterally rotate the eyeball. So these muscles together, the 4 rectus muscles plus the 2 oblique muscles surrounding the eyeball, are referred to as the extrinsic eye muscles, because they're the muscles outside of the eyeball that help control the movements of the eyeball itself. So now we're looking at a lateral view again, and this is the superficial view. We've already gone over temporalis. So when you chew food, when you move your mandible or when you chew food, you can feel your temple muscle move, which is nothing but the temporalis muscle right there where the cross is. Now the next set of muscles are kind of in the region where you have the pterygoid processes of the sphenoid bone. And you have 2 pterygoid processes, right? You have the medial pterygoid process and the lateral pterygoid process. So the muscles in that region are called the medial pterygoids, right there. And then you have the lateral pterygoids oriented towards the lateral pterygoid processes. Now these pterygoid muscles, both medial and lateral, help you move your mandible, aka lower jaw, from side to side. So think about it. When you're chewing your food, you're not just moving your mandible, you're up and down, or elevating and depressing it, but you're also moving it from side to side, which is courtesy of your lateral and the medial pterygoid muscles. The lateral pterygoids also help you lower or depress the mandible. So these muscles basically help with mastication or chewing. Went over the temporalis muscle. The next muscle that helps with mastication is the masseter. It is a very obvious muscle right here, and it's kind of oriented somewhat perpendicular to the zygomaticus pair and the risorius. This guy right here. So that is the masseter. It originates from the zygomatic arch. I'm pretty sure everybody knows what the zygomatic arch is by this point. And the maxilla, which is nothing but your upper jaw. It inserts itself into the mandible, more specifically the angle. You can actually feel the angle of your mandible if you palpate your lower jaw, and the ramus, or the arm of the mandible. So that is where it inserts itself, and it helps you bring your mandible back to its normal position. So the lateral pterygoid is depressing it, the masseter is elevating it. So the lateral pterygoids, the medial pterygoids, the masseter, as well as the temporalis are helping you chew your food or masticate your food. The next set of muscles that we're going to go over is the muscles of the tongue. Now the tongue movements are extremely important because one, they're important when we speak, and two, to keep in mind that we're not chewing on our tongue as we speak. So the three muscles of the tongue that we're going to go over is one, the genioglossus, right here. Two, the styloglossus. Styloglossus, anything that's glossus, glosso refers to tongue. So glossitis is the inflammation of the tongue. So glosso refers to tongue. The next muscle, styloglossus, right here. The stylo comes from the styloid process of the temporal bone. So that right there is the styloglossus. The next muscle goes from the hyoid bone and goes over to the tongue. A lot of students tend to misspell this or mispronounce this as the hypoglossus, but it's not hypoglossus, it is hyoglossus. Hyo as in hyoid. And it's this guy right here. So the three tongue muscles are the genioglossus, the styloglossus, and the hyoglossus. So we've gone over the movements of the face, we've gone over muscles that help you make certain facial expressions, the muscles that help mastication. Now we're going to look at muscles that help you move your head, neck, and the cervical region of the vertebral column. Now one of the major muscles of the neck is the sternocleidomastoid muscle. Look at the term sternocleidomastoid. Sterno is for sternum, cleido for clavicle, and mastoid is for the mastoid process of the temporal bone. So this muscle right here, it's a huge muscle, and it originates from the manubrium of the sternum, which is that superiormost heart-shaped region of the sternum, and the clavicle, which is your collarbone. It inserts itself into the mastoid process of the temporal bone, and it helps you flex the atlas and the axis, which is C1 and the C2 vertebrae. So flexion of the first two cervical vertebrae. So think about it. You have your head in the normal position, and you're in standard anatomical position. When you pull your chin downwards towards your chest, that is the flexion of the cervical vertebrae, which is what the sternocleidomastoid is helping you do. It is also helping you with the rotation movement of the head. So here is the lateral view of the sternocleidomastoid. You can clearly see how it inserts itself. Here's a tendon that inserts the sternocleidomastoid right into the mastoid process of the temporal bone. Now moving on to the nuchal region, which is the back of the neck. we have a couple of muscles that help with the rotation of the head as well as extension of the head. So you have the sternocleidomastoid that flexed your cervical vertebrae. We have a muscle here that helps you extend the cervical vertebrae. So from the chin down position back into the normal position. So the muscle right here is called the splenius capitis. The splenius capitis kind of looks, if you look on both sides, it kind of comes in like a V towards the nuchal ligament or ligamentum nuchae, which is the line right there in the center. So that is the splenius capitis. It helps you extend and rotate the head. And right below it, or right underneath it, you have the semispinalis capitis. So over here, on his right side, you see that the splenius capitis has been removed, so you can see the semispinalis capitis a little bit more clearly. So this also helps you with the extension and the rotation of the head. So these were your head and neck muscles. Now here's a great website. It is a free resource by McGraw-Hill that helps students practice the muscular system. It's a great resource for all of the systems. So they have a unit on the muscular system, the skeletal system, nervous system. So it's something that I highly recommend visiting this website and kind of playing around with it, see what you're comfortable with. It also has quizzes to test your knowledge about identifying the muscle as well as the actions, origins, and insertions. If you have any questions or comments, please feel free to send me a message at prof.muktiryan@yahoo.com. Thank you and see you in the next video.